Hi, I'm Keelan, and today we will be talking about the traditional motor approach of articulation therapy. Traditional articulation therapy focuses on explicit training of articulation by training the client's ear. With this approach, we use child-friendly terminology while the child judges the correctness of another's speech. This approach incorporates drill and/or drill play, gestural or tactile cues, and can include picture labeling. Target populations include individuals with motor-based disorders such as dysarthria and apraxia, individuals with syndrome-based disorders such as Down syndrome and metabolic syndrome, individuals with structurally based disorders such as cleft lip and palate and other craniofacial anomalies, and individuals with sensory-based conditions such as a hearing impairment. We use a hierarchy in articulation therapy. We teach target sounds first in isolation, then at the syllable level, then at the word level, then at the sentence level, and after we achieve those, we move on to reading and conversational levels. Traditional articulation therapy generally consists of 6 phases: the greeting and rapport building stage, the review of previous session, the establishment phase, eliciting and recording data, teaching, and the summary and review of the performance and objectives. Here's a video of our clinician Sky working with Chris. Chris presents with apraxia of speech associated with Down syndrome. In the hierarchy of mastery, we are working on the target sound F at the word level, having already mastered the sound in isolation and at the syllable level. First, view the first 2 phases of traditional articulation therapy. These phases are the greeting and positive rapport building phases and the review of the previous session.
Hi Chris, how are you doing today?
I am good.
Yeah, what are you doing this weekend?
I'm working, hang out.
You're just gonna hang out? Are you gonna do anything fun?
Yeah, I'm fine.
Yeah, like what? What kind of things do you do?
DVD, bowling, and golf.
Watch DVDs, go bowling, and play some golf? Alright, that sounds like a fun weekend.
Yeah.
So, do you remember our last session? Do you remember what sound we were working on? That's right, we were working on the F. Good job.
The next stage of therapy is the establishment phase, which trains the client's ear and establishes baseline data. After establishing the baseline, we move into the elicitation and data collection phase.
Okay, so I'm gonna say a word and I want you to repeat the word, okay? And remember, we're working on our F, okay? Good job. Okay. Frog. Your turn.
Frog.
Good. From.
Fun.
Good. Fast. Your turn.
Fast.
Good job. Okay, now we're going to go over some more words, okay? Front.
Fun.
Good. Fan.
Fan.
Good. 5. Your turn. 5.
5.
Good job. Okay. 4.
Pour.
Okay. Almost. I heard you trying to say it, but I think I heard you say pour and not for.
Here we can see that Chris substituted the F phoneme for a P phoneme by saying pour instead of for. This automatically moves us into the teaching phase of the session.
Okay, so when we make the F sound, our top teeth are going to be on our bottom lip, like this. Good job. And then we're going to push air out to do the. Okay, now let me hear you say it. Perfect. That was good. Good job. All right, so now with the word for, we're going to do the and then or. Okay, so I'm going to say it and then I want you to do it with me. Or. Good, now let's say the word together. For. Now for.
For.
Good job.
Now that we have instructed correct placement and modeling of the phoneme, we continue eliciting and recording data. As a note, We can also use cueing and prompts as needed during the teaching.
That was a good job. All right, now we're going to go back to saying a couple more words, okay? So I'm going to say the word and I want you to repeat it after me, okay? Fix.
Fix.
Okay, fix.
Fix.
Good. Box.
Fox.
Good job. Phone.
Phone.
Good job. Face.
Face.
Good job. You got those all right. Okay, so today you did a really good job. You got 90% of your production, so you only messed up one time. High five. You're doing really good. Next week, we'll work on saying phrases, okay? We'll do the F and we'll say it in phrases instead of words, so it'll be a little bit harder, but I know you can do it. Sound good? Okay, so I'm going to give you some homework to work on and practice for next session. And since you did such a good job today, guess what I have for you? What did I promise you last time? Do you remember? What did I say I was going to give you?
DVD.
DVD, your favorite, Rio.
Rio.
Good job. All right.
Here, the clinician elicited responses and recorded data. In a normal therapy session, this would take from 15 to 20 minutes. After Chris achieved 90%, they reviewed their objectives and the clinician summarized his performance. And that's how it's done.
That's how we approximate to articulate.
That's how the cookie crumbles and the therapy rumbles.
Night, day.
Bye.